Hello, welcome to the Right Physical Therapy Show. We're excited to be here today. We are live from Twin Falls. It is Thursday afternoon. Is that right?
3 p.m. Mountain
3
Standard
p.m.
Time.
Mountain Standard Time. This is exciting to be here. I'm Dr. Kate Anderson. We have Dr. Alex White in the house. This is like quite the dynamic duo. We've done a lot of good things together over the years. People probably know us
Probably.
out here.
Probably is about as gold standard as there is.
Yeah, gold standard. A couple here, and we're going to do good things today. So we're very excited to talk to you guys today about lifting weights and about strengthening your back. But first, I just want to thank everybody that we've talked about on here before. We've been doing our Stuff the Backpack donations that we do every year. It's what we do for charity. We bring in donations, things that we can donate to children in the area. In the areas that we serve, school supplies, and we've got a ton this year, and we're super excited about it. We're excited to take those to the local schools in the area, and we appreciate everybody that donated. You still have one more day. We are actually ending that tomorrow, and so if there's any other donations you would like to make, please let us know. And as of tomorrow, we're going to be delivering those items because school starts on Monday for a lot of places. Whew. I don't know how I feel about it, but it's definitely going to get things back on a normal schedule in my household. That's all I know, so that's going to be nice. But like I said, we are very excited to talk today about heavy lifting and about strengthening your back. And I think this is a perfect subject to talk about because honestly, there's a lot of misconceptions about this. So I'm just going to start naming off a few misconceptions here.
Yeah.
Like probably one of the biggest misconceptions ever is that like, hey, I need to strengthen my core. So I'm going to do a bunch of sit-ups, for example, right? The core is much different than that. I can tell you that. The sit-up is flexion of the trunk, and I just would ask you this. How many times do you need to forcefully flex your trunk in a functional way in your life? It's probably not happening very often. I'm trying to think of one single movement pattern like that. I don't know that I know of one, basically. And so that's something that we commonly do that's probably like not super effective in actually strengthening you to where you can move better and lift more and do some things that way, right? So that would be one misconception that we want to kind of debunk today. Here's the other one. I'm getting older and so I can't really like lift, right?
I don't do that.
I'm retired from that, right?
Yeah.
Like it's time for me at this point to retire to my rocking chair and I'll hop on my recumbent bike because that's all I can do at this point, right? Or like my elliptical because I don't want to put a load on my joints. That's also not true. So the research shows that you should continue to strengthen as you get older. In fact, it's one of the best things you can do. People start to have a hard time getting around, getting out of chairs because they grow weak. And that typically happens because they reduce their activity, right? Because they start to get nervous. And it makes sense. One of the best things you can do is continue to lift and continue to strengthen. So one thing that we love to do in here, we love to get the 80-year-old in here with back pain, work on that back pain, improve the mobility, and then start strengthening with some deadlifts, right? Like that's one of the best things that you can do, and we're going to go into more depth in that. But just because you're getting older does not mean that you cannot lift. Here's another one. If you're younger and you lift, you're going to like ruin your growth plates and you're going to stunt your growth.
Stunt your growth,
right?
Injure things that, as you're growing, all your energy's going towards your muscles and they'll stop somehow and you'll stop growing other areas.
So you'll be you'll be like 5 feet tall and just a ball, right? Yeah. So not necessarily true either, right? Like so strengthening as a youth is actually good as well, right? And it helps you develop the way you should. And actually, a lot of times the strength you gain, particularly in your core, in your youth, actually follows you for the rest of your life. That's why you get these people that like worked in farms and pushed around a bunch of wheelbarrows, which by the way is a great core exercises, right? Like pushing around wheelbarrows, like hauling hay, doing different things that way. They tend to be strong their whole lives, right? Because a lot of times that like baseline of strength that you gain as a kid will actually follow you for your whole life. And so definitely want your kids to get stronger, right? Another one would be like, hey, I'm injured, so like I can't do anything.
You gotta rest.
I gotta go on bed rest here because I've injured my back, right?
Yeah.
Same thing. One of the worst things you can do when you're injured is do nothing and rest, right?
Yeah.
Like it's one of the worst things you could possibly do. You need to continue to move and you want to strengthen during that time period. So those are just a couple things I want to talk about, but I want to talk about the specifics now for a second. So what does the evidence say about lifting, right? So first of all, what it says about lifting is that it is incredibly important for your functional ability, but also your ability to tolerate movement without pain coming on, right? So the stronger you are, the better off you're going to be, the less likely you're going to be to flare things up and have pain actually, right? It's important to be strong. Now, does that mean that you go and just like put on tons of weight and start lifting? No. And I think that's what some of these misconceptions come from, is that you get a kid that starts lifting too heavy, it can cause some injuries, right? Which isn't good. And we're not saying just go lift as heavy as you can. What we're saying is lift kind of an optimal load for what you need, which we'll talk about. Alex is going to go into detail on that, of how you do that, how you decide how heavy you should go, and different things that way. But build your strength up over time in an appropriate way, and that will do nothing but good things for you. So here's what the research says. You should move and load your injured tissues. It's catabolic, meaning it actually breaks down tissue when you don't move it when it's injured. And they kind of compared in a lot of research articles. There was one, for example, that compared stabilization exercises versus the deadlift. And for those that don't know what the deadlift is, show us the deadlift here. So I'm going to kind of pop it down like this. I think most people do, but
hinge pulling from the ground, keeping everything nice and straight, standing back up.
Yeah, typically with a barbell, but it can be with like a kettlebell or quite a few things that you can do that with, right? So that would be a deadlift. So they're basically saying, what's the difference between doing something like, I don't know, planks, bird dogs, some like stabilization exercises,
stuff you see on Instagram,
the stuff you see on Instagram, versus just straight up putting on some weight and starting to lift with a deadlift, right? Yeah. What they found is that they both reduced pain in low back pain, right? They both reduced pain. However, the deadlift was significantly better at improving your function and your ability to do more before any pain came on, right? So it actually made you more able to do things, right? So that's incredibly important. That's what strength can do for you. How about like when you have acute pain, like you're out gardening and you kind of twist it and boom, like, oh, but this back pain came on and it's kind of acute. Most of the time you think, I got arrested. What the research actually shows is that with acute low back pain, keeping it moving and doing something like a deadlift at light weight is actually going to help reduce the pain, improve the blood flow into that area, and improve the healing process of that injured tissue quicker than rest, which is interesting.
And I think you make a good point there, is that if you're stimulating that affected tissue, is honestly even just going for walks, riding a stationary bike, or maybe training a different body part for a day or two has a better effect than just resting, because no matter what exercise you do and you're getting your heart rate up, that's going to circulate the entire body. It's not like, oh, I'm working my bicep out, my heart's only sending oxygenated blood to my bicep. Your whole body gets an effect, and that's where I think a lot of people forget is, if you are training in an injury, or you do tweak a muscle, or you do something along those lines, is any movement is beneficial. And then Cade said I'd say the magic word being optimal is what gets you there faster, what gets you there the best and most efficient way possible.
Exactly. And so I've just seen time and time again where this is true, right? And the other thing is, I can't tell you how many times I've had, let's just say, for example, like an 80, I'm thinking of one specific patient right now, probably about an 85-year-old female patient with low back pain, right? Came in, she didn't want to do any lifting, any things like that, and we had to build up some comfort with that. But when when I first showed her, hey, we're actually going to deadlift with this kettlebell, and we weren't dropping it clear to the ground, like we were trying to find what was an optimal load for her at that time, and it was probably like a 20-pound kettlebell. Her eyes got big, because you can see the misconceptions were there, like, I'm not supposed to do this, I'm an 85-year-old woman, right?
Yeah.
There's the stigma, right? And guess what? She started to do it, and she was like, okay, that's actually not as bad as I thought. By the end, she was doing it with a 50-pounder. We're going all the way to the floor, and you could just tell she was like confident. She was just popping up out of chairs. Like, she had built some strength. Like, I don't think people understand that. Like, you want to become stronger. You can do more when you're stronger. So, like, let's lift some heavy stuff. Like, let's progressively lift heavier and heavier. Like, one of my favorite sayings ever is like, listen, stronger people, they're harder to kill, right? And that's true. Try killing them. I've never killed anyone. I just want that on the record.
Yeah,
but I would imagine if I did, it would be harder to kill someone that was real strong, right? Like, I probably wouldn't mess with you. I'd probably go after Tyler, for example. Thanks, bud. I hope he watches this. But that's the point. You can build yourself up by gaining strength to the point that you can handle more, you can do more without getting pain, right? And so that's probably one of the main takeaway points. So Alex, take away in terms of just like what exercises are best, how do you know how heavy you should go, just some of those main questions a lot of people have.
Yeah, and I think strength is one of those areas that I think gets lost in social media or gets lost to I'd say what we see on mainstream media is this idea of big muscles or intimidating stature or, almost unattainable goals. And I think strength has way more to do with you feeling confident with how you're moving. You don't need a bigger muscle to move better. You need to know how to use it better. You need to learn how to move better. I'd say some of the cardinal movement patterns that we address a lot in therapy, but just you will see in the gym all the time is hinging, like I demonstrated with my deadlift, and squatting, going down. I mean, you can put a weight on you, but also getting up from a chair is squatting. Pushing, pulling. Cade used the example of a wheelbarrow. Well, really, you've got a lot of stuff going on with that. Our lives are built around these functional movements, and those are great places to start. Your body weight is a great safe place to start too. Is like I just said, sitting and standing from a chair repetitively can be where somebody could optimally load to start. How do you make that tougher? Make the chair shorter. Add weight to it. Make the surface unsteady. There's so many ways that you can go from that. But the cardinal patterns are really going to help you know where to start. Is if you can pull and push and do all these things in your normal day-to-day, and then your goals are above that, what do you do to get there? And I think listening to how it feels is, I don't want to throw out rep ranges because unfortunately there's not enough research to support that. And I don't want to give my personal opinion because anything more than 5 reps is cardio to me. But anything that you're feeling a stimulation in the right area, so you're feeling fatigued, you're feeling your heart rate go up, you're feeling, say you're working a specific muscle in your legs and you're starting to feel like we call the burn. I'd say the burn is probably my favorite thing, that somebody who doesn't exercise feeling that for the first time in the clinic, it's exciting because they're like, yeah, it doesn't hurt, but I don't like it. Yeah. And I think that honestly is the most music to my ears that I get on a daily basis, is having them encounter that non-painful body response to movement. And it's so exciting because, like Cade said, that light bulb going on, or those eyes getting big, and that confidence, that, example of an 85-year-old, she didn't get a bigger muscle in 20 minutes. She built confidence here, and she built control with the movement. That's the exciting part. And that as you start to build that, you're going to have this, hankering to either stay there because it's safe and comfortable, or you're going to have this idea, and I'd say age probably plays a role with this, of I'm going to put more weight on and see how much I can do. That ego lifting idea of, got to make sure somebody thinks I can lift more than them or this or that. And that's where strains and pains can happen, and we by no means want to be on either end of the spectrum. But I would say finding the happy medium is where you're figuring out where you can stress yourself and do a little bit more each week. The general idea is about 10% increase. So that would be, instead of 50 pounds that week, 5 more pounds the week after. And that's with steady improvements, which as you become a more seasoned lifter or exerciser, that may be less. But it also happens with consistency. You're not going to do an exercise once a week, do 10% better next week. That's probably just not going to happen. And I know that's probably a shell shock to some. But if you're not doing it consistently, there's a chance that that buffer, Cade mentioned tolerance, is going to not go up, and so your strength won't just go up magically. It's something that you do consistently. It's just like any other skill that you develop. If you only read once a week, you're probably not going to become a faster reader or if you only speak, you're not going to be more affluent. Like, those are things that people forget when it comes to the body, is consistency. And so that gradual progression is huge. And I would say building on that, like we said a few times, deadlifts, but also, if you're a walker, be a walker. If you're a swimmer, be a swimmer. But in some of those repetitive tasks, you may benefit from a complement. If you only swim, you're at risk of some other overuse injuries. If you only lift certain movements, you're at a chance of this. Like, it's just how it works. Yeah. And so if you can find that balance and find that way to progress safely, that's really, it doesn't need to be deadlifts. Are they great, and are they simple, and do they hit the spot for when it comes to strengthening your back? Absolutely. Does that mean that you have to do it? No.
Yeah, for sure. Yeah. And I love that. Like, I think, a lot of people question, how much should I lift, right? Like, and maybe we've all seen this in the gym. How I think I saw him doing that at the gym recently, but
He's
just kind of like dropping a little bit. Let's say you put 350 on and you do like 6 terrible reps where you drop 3 inches. Guess what? You're probably better off to go to 175 pounds, get really low, have good form, and get more reps in. Like you're gonna actually get more strength gain. So you kind of have to take ego out and say what's best for my body right now.
Yeah.
And what you'll find is that when you do that, and then in combination with like eating well, getting enough sleep, and some other things that we can probably talk about in another Facebook Live, you will gain strength pretty quickly. I think people will be surprised how quick you can gain strength when you apply things the correct way. And so if I had to say like kind of some main takeaways, like it doesn't matter if you're like a 70, let's say you're in your 70s and you're starting to find that it's just like harder to get out of the chair, right? You need more strength, right? Like if you're, let's say you're in your mid 30s and you're starting to notice that every morning you get out of bed, or like when you go home from work, your back's just achy, like you probably use some more strength. Like let's say you're a 16-year-old, you're playing football, and man, you can just get knocked over easy. Like it just takes a little bump to knock you out. Like you probably need more strength. Like a lot of times the answer is more strength. The question is, do you know what you're doing, right? And that's where we come in. That's where we come in. So I would say this, we want people to be active. Some people I think sometimes think, I don't want to go to physical therapy because they're going to tell me not to run, or they're going to tell me not to lift. Don't do that. We want people to be as active as possible. In fact, I want you to go out and start trying to work out right now based off of what we're saying. But if you're doing it, it's causing pain, there's probably a problem with your movement pattern. We can help with that. If you just cannot figure out the form, there's probably something going on with your movement patterns that we can help with. Like that's where we can help you with this, right? And help gain your confidence to get you to where you need to go. And so if there was a takeaway, it'd be that. Get out, get moving, and we are here to help you when you got questions. What do you have for takeaways?
Yeah, my main takeaway here is just don't wait. I think unfortunately with low back pain in particular, people far too often do the wait and see. When really within that first, I would say it's 5 to 7 days. If you can access physical therapy, that if you implemented intervention within 5 to 7 days of initial low back pain, your incidence of recurrence is lower, but also your length of disability, meaning length of pain, is significantly less. Your healthcare costs are less. Is that urgency is so beneficial down the line as well as in that moment, that if you're encountering it, even if it's for that day, that after, that week, that you're not doing what you want to do, I would say help yourself by getting out of your own way. We can definitely take a look at that, is that you're going to experience it for less often. You're going to go do more. You're going to then, after you do that, you're not going to feel it as often because you're going to know how to do it. And I think that's where people, when they do come in, finally have that aha moment. Is, I hear it all too often. I should have come in here 2 months ago.
Yeah.
I should have been here 2 years ago. And we don't hold that against them. It's just a different recovery road versus I know I'm impatient. I don't like hurting for more than stubbing my toe and walking it off. So if I can do something about it, you owe that to yourself to do that.
Yeah, perfect.
So whatever that looks like.
We'll definitely reach out to any of our 14 clinical locations throughout Southern Idaho. We are here to help you, and it was good having you today, Alex.
Thank you.
We will be back for more, but thank you for joining us, and we'll be back next week.